There is a study going on in Duke. I mean, if you just type Duke stem cell therapy study, it will come up. It's in process. They're actually in the final process. Sometime during this year, the results should come out. I've just been, so busy, I haven't been keeping an eye on it. But that's something for you to keep an eye on. It's a big study. It is well designed study. It's a proper scientific study. They're studying the effects of the child's umbilical cord cells when given very, very early on, right? That's what they're studying. Keep your eye out for this, and it may not help your children, but if it comes out positive, then maybe there's something to it. But right now we have no evidence. You shouldn't be doing it at this point at all. And chelation, please don't do chelation, period. It can actually hurt the child seriously. It's not like GFCF diet where sometimes it will hurt, sometimes it won't hurt. If it is not necessary, do not do it. I'm sorry, what exactly is this? Chelation is like, people send, your child's hair, your child's nails, your child's urine, God knows what, for some kind of testing for heavy metals. They say your child's lead levels are high, mercury levels are high. See, the only way we know how to test lead is in the blood. Right? And yes, there is lead poisoning, but severe lead poisoning is very rare these days, except when people give some Ayurvedic medications. I've seen lead poisoning, and I've given chelating medications just for a handful when there is lead poisoning because of Ayurvedic medications. Do not give Ayurvedic medications. They have heavy metals in them. Homeopathic, go ahead. You want to, you can. But do not give Ayurvedic medications. So when there is very high levels of lead in your child's blood, I usually try to test for lead anyway, because that is one of the reasons for autism, could be one of the causes. So if there is high lead levels, then for medical reasons, you give medications to absorb that and sort of excrete that from the body. It needs to be done when there is a high blood lead levels, right? But then people doing skin tests, hair test, nail test, urine test, we have no way of standardizing this, and people don't go for chelation to anybody that is not a mainstream medical doctor. In Rainbow, we have our hematologists taking care of that, because when there is lead overload, you got to look at iron and all of that. So I just let the hematologists do it. I don't do it myself, but we have done it in Rainbow, just like maybe 2 or 3 kids, right? But do not just go chelating your kid, right? Do not, because it can cause serious side effects for no reason, no benefit. Do not do hyperbaric oxygen therapy. Have anybody heard about hyperbaric oxygen therapy? You have, yeah. And there is, you've done it, yeah. So there is a, I'm sorry?
80 sessions.
God bless you.
We've also done IV chelation.
Pardon me?
We've also done IV chelation.
I know.
Yeah. We did this Ayurvedic heavy metals therapy. We spent some lakhs of.
I know. Don't do it.
Absolutely no result.
Don't do it. These are things, don't do it. I mean, there is no discussion about this. Just don't do it. Hyperbaric oxygen therapy does not work. Absolutely does not work.
Yeah. Is there a protocol that if you come across such organizations, what do you do? Because
what do I do?
No, what do we do if we come across such organizations? Because last year somebody introduced me saying that this is also an NGO and they also do what you do and they want to empower parents, and I go to their website and I see an entire section which has HPOT, which has chelation and all of that. Then I look at the doctors involved, some of them had medical qualification, and they have put in things that would make you believe that these things work. there were papers. So I dug deeper into the papers and conferences they have attended, which were essentially oxygen therapy related conferences. So if you are in that conference, it is basically a biased set. But what do you do about it? When it troubles me to this day that there's nothing I've done about
I don't know if there is a redressal process. I don't know if you can complain to the medical council and stuff. My guess would be, given our system, nothing will be done. I think the thing to do is what we are doing now. You know, the more you educate the parents, the more they know, especially we have to get young parents, you know, parents of children that are newly diagnosed, because by the time, you know, a child is 10 years old, they've been there, done that, they know it doesn't work, but they wish they would have known when the child was young. So we
parents that it worked for them, it makes you very hopeful. As a parent, it makes you very hopeful.
Right. No, I know. So we got to get young parents, we got to give them evidence, we have to put the information out to fight misinformation. We really have to have providers. When a family comes to you at the first diagnosis, that is the best time to give them information. You put good information in there. They're going to get a whole lot of bad information later on, but you put good information in there first.
And one such person was benefited by getting that good information from you. One of those
Thank you.
thing, a lot of parents that I meet where I go to therapy, and people whom I observe in the community and otherwise, even when I go to my hometown, like the recently, the kids, some of them I come across, a lot of people are clueless. Like just one sentence that I picked from, like, was a big takeaway from you when I met you. One from you, one from ENT specialist in Apollo. He told if your kid is able to hear, at some point the speech is going to come out. And the takeaway from you was there are kids who come in at 5, 6, 7, 8 years. They can do. I mean, they can. You asked my son to read something, tell some story from the picture, and you said they stop at 1, 2 sentences. So I keep telling a lot of parents, see, they will talk, because a lot of us live in denial, especially as one of the parents said, from 2 to 4 till 4, you deal with it. I mean, you deny, you think like your child is not going to be there, and you might be one that case, you will get away from there. So they might speak, but it wouldn't hurt. The therapy is not going to hurt. The behavioral therapy is only going to add something to their personality, even if it's nothing. And the speech might come in, the language is going to pick up faster.
Yes.
That was my big takeaway, and it did help me in so many ways.
Great, I'm glad. Yeah.
We hopefully will come over to other things.
Yeah, I'm glad.
B12 shots also.
Yeah, so B12 shots. You know, as long as you're not hurting the child, you know, by giving them every day. I mean, B12 is a water soluble vitamin. It's not dangerous per se. You give more, it's excreted in the urine. It's very expensive urine, but you know, it's gonna go away in the urine, most of it. But there is no evidence that it actually improves. You know, the so-called biomedical treatment, it's no evidence that it works, and all kinds of expensive tests that they purport to do and send only abroad. We don't have, nobody even understands what those tests are. I mean, nobody knows anything about them, absolutely nothing. Do not do it, don't do it. You know, don't do those stupid expensive tests. You want to give a little bit of B12, go ahead, give a little bit of B12. I'm not going to stop you. You want to give a little bit of magnesium, look up, you know, internet, look up safe doses. You want to give, I'm not going to stop you from doing that. But don't go around doing all of those expensive tests and going through protocol. I mean, I have allergies and I have to take, you know, sprays and medications in the morning and in the evening. I am tired of taking my medication every day. Your child who is 2 years, 3 years, you're giving them handfuls of tablets every day, morning, afternoon, evening. That's stupid, especially because it doesn't work. It just doesn't work.
Why it has happened that, all this magnesium and the mercury and all this has been associated with autism? Isn't it common with all the children, like
so
other children also?
so
Why is magnesium,
so
zinc and everything has been associated with autism?
the honest answer is I don't know, but this is what I think. Because we don't know how to help children with autism. We don't really know how to help children with autism in a definable way. I mean, all I'm telling you is do therapies, right? And then I'm not guaranteeing any improvement or cure or anything. So then there is a sense of hopelessness attached to autism. It's like, it's not a terminal disease, but it's like, it's your hope for a perfect communicating child is lost. So once that is lost, then parents look for things that might work. I think this is all out of the hopelessness. That's just my theory. Nobody knows why there is so much misinformation around autism. I think it is related to the hopelessness that people feel.
Because as parents, we want to find a reason.
Yes.
We want to find a reason for the cause.
Right.
My son was tested, his blood test showed high heavy metals. So I was hopeful if the heavy metals were reduced, probably it will ease it.
Right.
I didn't know, I was not really looking for a complete cure.
Right.
That was never in my mind. But then I thought maybe the troubles that are going inside his body and he's not able to communicate, maybe that would go away.
Right. Yeah. So, but that's my theory. Nobody knows. But there is a whole industry that lives off of parents with children with autism. There's a whole industry that's feeding off of you. Don't let them. I mean, there are things that are not going to hurt your child. You want to do them, they're not going to really cost a whole lot. They're not going to, take a lot of your time. By all means, do it. I mean, if you feel like I want to give him a little bit of B12, some parents give some kind of herbal things, parents feel better giving them Mentat. Mentat is one thing, even doctors have been prescribed. Brain IQ, Cognicare. Again, it doesn't work. You want to go ahead and give the child that. You can afford those 500, 600, 2000 rupees a month. Go ahead. I don't think it's going to hurt them in any way. Brain IQ is just omega 3s. Yeah, omega 3s are just good in general. I don't think they're going to help the autism, but they're just good in general for everybody. You take omega 3, give your child omega 3. You take vitamins, give them a multivitamin. I don't care. So some are common sense. You do them. It's not really painful for you to do in any way, and it's not going to hurt the child. Do it.
But do they put on excessive weight by taking omega 3? I mean, I've been giving fish cod oil, deep sea fish cod oil for my son.
No.
Okay.
No. That's something else. Ben.
Okay. For autism that I understood, but will that work for any other mental, like mild mental retardation or any other mental disability? Will it work?
No. I've heard that certain organizations go into these special schools and they say, it cures ADHD, it cures, intellectual disabilities, it cures autism. It's a cure-all for everything. No.
What does it do then? What does it cure? Is it very, I don't know. I mean, when I was...
It cures their poverty. Doesn't cure anything in your child.
Make us more poor.
There are certain neurological diseases that they're researching it. See, research is ongoing and everybody looks at stem cells as having this wonderful potential. We don't know at this point. We don't know. And what we are seeing in practice doesn't seem to do much. The way they're doing it, at least, it doesn't seem to help. If and when we have substantial evidence, I'll be the first one to tell you to go ahead and try it in this particular way, right? See, evidence changes every day. It might change tomorrow. Like if you have substantial evidence and if at that point you want to try it in a particular way, then you can. But as of now, there is no evidence.